Planning a vacation full of fun, sun, sightseeing, and breast implants? Well, places like Venezuela, Costa Rica, and Colombia are not just relying on the rich history and culture to attract tourists. Now they're luring them with state-of-the-art medical facilities that provide treatments at a fraction of the cost you would pay here in the United States. Joining me now is Jonathan Edelheit, CEO of the Medical Tourism Association, and Dr. Malcolm Roth, who is the president of the American Society of Plastic Surgeons. In your definition, what is medical tourism?
Medical tourism is when a patient travels from one country to another for four reasons. It could be affordability, quality, access, or availability. And medical tourism is safe, but if you do it right, meaning that you have to go to the right doctor that's accredited, you have to go to the right hospital that's accredited, the patient has to do their education. If the patient doesn't do the education, they can run the risk of complications, but if they do the research and make that educated decision, then it can be done safely.
How safe is it? Doc, I'll start with you.
I think that patients should be really careful. The thought about saving money on plastic surgery can be a very costly thought in the end. Because if there's a complication or a problem, usually it's going to cost a lot more. It's difficult enough for patients here in the United States to check on the qualifications and training of their surgeon and the safety of their facility, the anesthesiologist's training, and the equipment being used. But to try to do all of that research from here and potentially go to a surgeon that they only know because their neighbor had a good outcome potentially could be really hazardous.
So walk me through how, in other words, how do I know how to choose the best place? How do I check the facility? How do I check the doctor? I mean, so let's say, how would I do that? Do I go to your site?
The first step would be to come to us because we're the nonprofit trade association for the industry. We have members that we do due diligence on. We also have a consumer portal, medicaltourism.com, which just provides patients with information on country destinations and healthcare. But they can come to us. We can refer them to a hospital that's a member of ours that is internationally accredited.
How you will refer them on the basis of what?
It would be what procedure they want and where they would like to travel to. Because patients usually have an idea of where they want to travel to and the cost. And the travel could be because of the time distance and how far they want to travel.
So anyway, would I come to you and say, listen, I only got $5,000. I need to get my knee done. I like it to be hot. Hot weather, preferably. Is that how they pick a site?
Well, typically they actually come to us with a country in mind. They don't come to us and say, just pick a country and this is how much we have. And we refer them to our members who facilitators who send patients overseas, or the hospital.
Yeah, but what are the questions, whether it's here or abroad, that a patient should ask when they're considering plastic surgery?
Well, it's different. Here in the States, it's very easy. Go to www.plasticsurgery.org. You'll find out if that person is a board-certified plastic surgeon. And if they are, they've had a minimum of 6 years of surgical training. They've passed both written and oral board examinations. They have to operate only in accredited facilities that have all the bells and whistles a hospital would have. They have a code of ethics and continuing medical education requirements. There are some countries where they have plastic surgery societies with similar training and similar requirements. And we as an American society are reaching out to them, and we've partnered up, signing memorandums of understanding so that we can acknowledge those people that you mentioned who are around the world that do practice with the same standards that we have in the United States. But do your homework. Make sure that person does the procedure regularly. Don't just check your Aunt Tessie and see that she had a good result. If you have a complication, then your complication rate was 100%. And if you get it when you're back home in the States, it may be very difficult to find somebody who's willing to take care of you.
Right.
It will probably be more expensive, and the outcome will probably never be anywhere near as good, even with revisional surgery, as it would have been if you'd had a safe outcome to begin with.
Right. For more information on medical tourism, log on to www.medicaltourismassociation.com.